Today's guest is none other than Dr. Reema Nadig, a doctor and entrepreneur. Dr. Reema is the co-founder of Kite Senior Care, and today she is leading the way we see senior care in Indian societies. From being the largest care provider for dementia in India, along with having a career that not only spans into senior care but also now expanding rapidly into senior living. On this podcast, we talk about all things senior care. We talk about what you could do to improve your parents' health and not only improve their health but help manage, treat, and cure their illnesses. So, hi, ma'am. Good afternoon, and thank you for giving us the time to come and have this podcast with you. So, before we start off, I just want to ask you, how are you doing today, ma'am?
I'm doing very well, and thank you so much for reaching out, especially youngsters like you. I think it is very important to keep motivating you all and nurturing you, and especially with the topic that you are talking about. I think it is a hot topic and very much required. So wonderful to see you today.
Thank you so much, ma'am. And likewise, I feel really honored to actually have the opportunity to, be able to have conversations with you where you're working in a space that really is required for today's day and life that we are living in. And 10 years back, we only heard about hospice care. And we only heard about senior care in the US, senior care in other countries. But today, it's become a lot more of a need in India as well. And you took this up 10 years ago when nobody was talking about it. What actually drove you to do it?
To be very frank, as you rightly said, it was the opportunity. And we can't talk of a story that, oh, my grandmother was ill or my grandfather was ill, because every single household has the same story.
Yes.
Right? So the trigger was the need. So the need is giving us opportunity. So we should be able to do something about it.
Yeah.
So that was the one point start that we started talking.
Right. So you finished your medicine, and how was the transition to geriatrics and now senior living and senior care?
I will tell you. So I finished my medicine around 25 years back. And while I was doing my internship, I loved medicine, of course. But as a personality, I like different things happening on different days. So while I was doing my internship, I thought to myself that I can't be doing this for the next 40 years of my life. Whether I become a surgeon or become a pediatrician or a medical consultant or whoever, I will be doing similar things for the next 40 years of my life.
Right.
And it's not that exciting. So, and my second option, if I didn't get into medicine, was doing business. So I thought, let me get into that. And at that point in time, this new MBA for healthcare professionals was coming up.
Right.
So immediately after my internship, I got into doing my management in healthcare and let's see what happens. So risk, of course,
Yes.
I had taken that risk to see that, something new is happening. Let's see how it goes. I said, anyways, I have one skill. If this doesn't work out, I anyways have a backup.
Yeah.
So I will go back doing whatever I have been trained to do. But fortunately, it all just kept working, and I started my I worked, before this entrepreneurial journey, I worked in medical insurance. I worked in medical devices. I also wanted to get some experience in how the hospital runs. So I ran multi-speciality hospital. And this idea is not originally mine, right? This idea was originally my partner's, Raj, who you had met, right? His idea. And he started off, and when I heard about it, so we are friends, and I heard about this idea, I was supremely excited because I knew where it is going to go.
Yeah.
So I said, let's jump on it together and start building it together. And slowly, we just had 100% investment by sweat, money, blood, everything into this, and we started growing this from a very small place to where we are today. So, if I could just go back to the journey, we started as a daycare center for seniors, healthy aging seniors. To get them, this connection was required, the social connection, which was there. And our mentor was Dr. Arvind. So he lived in the UK for 25 years, and he saw how the geriatric space is over there, how the elders are cared for, what are different kind of facilities available over there. which was absent in India at all at
Yeah.
that point in time. And we started brainstorming with him, and slowly with his guidance and his ideas, with our hard work, we started off small.
Yeah.
You know, at that, as you rightly said, 10 years back, nobody would want to give any money, or
Yeah.
and everybody has limited resources.
Yeah.
So as a daycare center, we would started inviting. We had members, elder members. They would come, and there would be social engagements. They would talk to each other, and while they were there, we organized for a primary health, primary doctor and a physiotherapist. Then most of the time they would learn sardi, khansi, whatever they need some treatment,
Yeah.
chota mota treatment they want. They don't have to go to big hospitals or wait in queues. So they can come here. While they are engaging themselves, they can get treated.
Yes.
And the small aches and pains, we had physiotherapists to help them with it. We used to call people to do chats to help them the relevant topics for the seniors. So it was doing very well, but from the business perspective, you can't scale it. You know?
Yes.
And then people would come and visit, etc. But sometimes they would come, sometimes they would say, no, we are not able to come because grandchildren are there, or I have somewhere to go, etc., etc. So our dream also was that, let's start doing something for the seniors more deeper. How do
Yes.
I engage deeper? And they get sick. So what happens with them is the sickness part can't be ignored. When they get sick, their recovery is longer. I said, okay, let's start looking after them in their recovery journey also. Is when we thought about home care too. That they also started asking for, we trust you, you are dealing with elders, can you send help home? So is when our home care vertical started.
Right.
And while we were working on it, of course, the idea of doing much more deeper engagement with them was there. Is when our idea of care center started. So we opened our first care center where you visited.
Yes.
Right. So in North Bangalore, and it did very well. And then slowly, as we were growing in our journey, people also started realizing that, yes, this is the need, because the customer also needs to know. The people who have to use use the services need to know it is my need.
Yes.
Right. So that's the kind of, I think, if I may call it the disruptive, we call disruptive technology,
Yes.
or whatever. So this was a disruptive idea where we started to do something very different that people had not thought. Culturally, India is, children have to take care of parents. It is a taboo to, send them anywhere
Yes.
else. In spite of that, we said, let's jump in, because the Indian scenario is also changing from joint families to nuclear families.
Yeah.
Then people shifting out of the city, whether in the same country or different countries, for the economic compulsions.
Yeah.
Not that they don't like their parents. They were feeling very guilty that we have left our parents back home.
Yeah.
Who will be giving them that export care? Who can kind of replace us as proxy children?
Yeah.
So how things will happen, and especially when any sickness happens, that's a huge
I think,
stress.
like you said, it's a huge burden.
Yeah.
More so when sickness happens, because
Yeah.
at least day-to-day care, I think they would still be able to visit
Yeah,
once in a
yeah,
while and do it. But when we were talking about when sickness happens, there is also something which we know now as a caregiver fatigue,
Yes.
which most people, weren't talking about it, but
Yeah.
they were silently going through
Yeah.
at their homes.
Yeah.
And then this led to a lot of disputes in families.
Absolutely.
And a lot of families breaking up when the illness is there in the
Yeah.
family, which were otherwise normal.
Yeah.
And I think, how is that being addressed now, and where do you see that going, and what is it actually?
So, as I was mentioning earlier, people are now recognizing that we get cooks at home. People who don't know how to cook, they're
Yes.
giving the cooking part, outsourcing it to a cook, right? Health is similar.
Yeah.
Everybody is not a doctor or a caretaker. In nursing courses, nobody has done how to change a diaper, how to seat them while feeding, etc. The caretakers, the training that happens. So people at home are non-doctors. The biggest pro is that they're kids. They're emotionally attached.
Yes.
But as far as the expertise is concerned, they don't know beyond a certain limit.
Yes.
So they are realizing that let us outsource this logistical part. It's logistical, it's
Yes.
work.
Yes.
Let's outsource this logistical part so that we are not physically fatigued. So emotionally, we have more space to connect with our parents.
Yes.
So that is the mindset change that we are seeing in India right now. And surprisingly, we were thinking it would be only for people who are abroad, but no, it is for people who stay with the parents here also. We are changing that.
Yes.
And the new generation of elders are independent. They are not expecting things for the kids to do.
Yeah.
We take our own decision and we will do this for ourselves. You
Yeah.
can live your life.
Yeah.
So that's also changing.
See, I think that's such a positive change, I would say, because earlier, if you remember, the conversation was that it was almost a taunt, not a conversation, that once we get older, they are going to dump us in an old age home and they'll be very busy. We took care of them all this while, but now they're going to send us to an old age home. What is that conversation like now, if you were to put a line to it?
It is now changing. Okay. We divide the senior group into two.
Right.
Young seniors and old seniors.
Yeah.
Right? Young
This is
seniors
a
are from
nice,
60 to
yeah.
80.
Yeah.
Right? And then 80 and beyond are the old seniors. We are seeing both of the seniors over here. So in the 80 plus age group, we are seeing seniors who are living in their own homes with their kids. We are taking care of around 2,000 elders who fall in that group living in senior living facilities. So we are seeing the outlook to the world,
Right.
over there, how they have taken a decision, where the kids, most of the kids are abroad, so they took a very conscious decision. When I retire, I will retire in a senior living facility, and most of the wives said, I have cooked for you for the past 45 years, I don't want to cook anymore.
Right.
So these are the small perks that you get when you are moving into a senior living facility. And the senior living facilities are your lifelong resorts.
Yes.
You're living in your home, your housekeeping is getting done, your food is getting cooked, you have nurse or a wellness center, right? You walk 20 meters and you will be in your wellness center. You have nurse walking to your house when you are alone. You have engagements happening. There are lots of talks, lots of different activities happening for you. They are socially very busy.
Yeah.
And now the new age retirement communities also that we are talking about. So retirement communities are synonymous with senior living, right?
Yes.
So when they are healthy and healthily aging, they are coming up as very, very exciting spaces for them. Now, one of the senior living facility that we have in Bangalore, I went over there, they're telling we are more busier over here than we were in our younger days, because every day there is somebody's birthday and somebody's anniversary and they're partying every day. Something or the other is happening every day. So they love it.
Yeah.
And when they have to go travel, they just lock their homes and go and travel. There's nothing to be shut, nothing to be worried about security, nothing.
Yeah.
They come back home, they will call the housekeeping people or the in charge over there that we are coming by this particular date, keep my house cleaned. It's all done. So
such
it
a
is
blessing.
Exactly. So nowadays, I think this is the paradigm shift we are seeing, but it really requires a lot more work for sure. It is very common in urban India right now. Rural also slowly it has to go over there. Right now we see it in grade A cities only, but BC also has to work.
Yes.
And one part is the healthy aging part.
Yeah.
But there's large population of elders who are not as physically healthy or active as many others. Take chronic conditions, whether it is Parkinson's, hypertension, diabetes, or dementia, Alzheimer's, depression. So many things are there which elders go through. So there is that part of the elders also that needs to be taken care of. And senior living facilities are not adept or equipped to take care of that part, because there are two extremes. This is healthy, that is sick.
Yeah.
And the same kind of person can't take care of both the things. They are not trained to do that. So we have different kind of spaces. So now we come from the senior living, we come to senior care.
Yeah.
Where the care component becomes more than the living component. From lifestyle, it becomes more of the care.
Yeah.
Where management takes over the fun part of it.
Yes.
And those kind of people are then they are doctors, nurses, therapists, etc., to look after that part of the need.
Yes.
So
ma'am, in senior care, now you told us about senior living, wherein the day of the life, how it's going to be like for them and what they'll be doing. But now when it comes to senior care, it's more of an important thing as a nation for us, because we're going to have more sicker people. That means we are going to be spending more on taking care of our health, and now we have this entire debate of health span versus lifespan.
Correct.
And we are also now seeing that out of the 100% of the people, 10 people, if they are walking into our OPDs who are older, out of them, 4 or 5 people are having early signs of dementia. Why is that happening, and what is that we are looking at in the on ground reality?
See, definitely the dementia part of it. Dementia is, 1 in every 10% people that you see are having signs of dementia is one part of it. But apart from that, there are many NCDs that the people suffer with. And the rise of NCDs is one of the major risk factors for dementia. And these set of people, these are the baby boomers.
Yes.
People born in 1950s and all, right? At that point in time, India had just gone independence. Right? They had to work very hard to where they are. The quality of food that they used to eat, I mean, it didn't have any pesticides or insecticides at that point in time, but the balanced diet concept was not there.
Yes.
Right?
Because we had a lot of ads saying if you drink tea, then you are an English woman.
Yeah.
If you have Marie biscuits, then that is how you're supposed to do it. That's how the English did it.
Right. So we are seeing a lot of nutritional deficiency anemias. Then there is a lot of these NCDs, the hypertension and diabetes causing a huge risk factor. Then alcoholism and smoking is another huge risk factor.
Yes.
I am removing the genetics part of it. I mean, that is something that we can't even help.
Yes.
So I'm not even wanting to take it as a consideration that I can't say that how many people have genes which will lead to dementia.
Correct.
That is one part of it. But there is another part which we can plan to get healthy olders.
Yes.
How do I live my life today to be a healthy older later on?
Yeah.
As your health span where we talk about.
Yeah.
So do healthy to stay healthy. And for elders, it is, what does health mean for them? Health means for them is independence.
Yes.
That do I require somebody to help me to go to the washroom is not what they want. And that leads to a lot of problems. So we will also feel the same thing because it's the human requirement. If I keep myself healthy, I will be independent as long as possible.
Yeah.
So that will give me a very nice psychological, upbeat for me to live my life. And that the health span is physical and psychological.
Yes.
Both over here.
Both, because
and
it
this
affects both the aspects
Correct.
of their living.
Correct. So that's why if you see a lot of people nowadays, I see a lot of YouTube videos and there are a lot of senior influencers that are coming up. Very brilliant. It is very nice. They're dancing or they are starting to do certain things at this point in time.
Yes.
Learning new hobbies, something that they have been wanting to do earlier. So all those things are very nicely taken care of at this point in time. So. And if you see from the care perspective, acute care is short.
Yeah.
Right? A medical episode or a hospitalization episode is smaller. Yes. The treatment is small, but the recovery is long.
Yes.
Especially when they are seniors, their cells have aged. The way they metabolize medicine have changed. Everything is slowing down. They would have lived with this disease for the past 40 years. They would have had the medications for this disease for the past 40 years.
Yes.
They are living with the side effects of this disease and the medicines for the past 40 years. So everything changes when they grow older.
Yeah.
So their recovery also becomes different from what it is from younger people, and it takes longer. And they need some kind of assistance to bring them back up to the threshold of their health. And hospitals don't have time. They are very fast and looking at treatment. They're just treating and sending. They're unable to concentrate on the recovery.
Yeah, because that's also not the hospital's load, because their main job is to make sure that you're functional.
Correct. Right. So, but once these people go out, so in a senior's life, 20% of the health need is acute.
Yeah.
80% is chronic. And this 80% lies outside the hospital space. And then who are there outside to take care of them? Family. Family is not trained. So what do we do? So that's where people like us again come and are trying to fill up the space of out of hospital care, where we help them to manage their conditions. We
Yeah.
don't say that treat the conditions, but we manage the conditions. Whether it is a post-hospitalization, rehabilitation, it could be a surgical or a medical, it could be hospice, it could be palliative, it could be dementia. And people, when they get into this stage, except in hospice where they will live for a week or a month, in all the other conditions, whether rehab, palliative, and dementia, they will live for years. At least 5 to 6 years they may live. So, see, we are talking about now the 80% of the care outside the hospital space. Um, so, the experts have to do that. And over there, it's a multidisciplinary approach.
Yes.
It is just not the presence of doctor. Doctor decides the treatment, but the nurses have to deliver the treatment, deliver the care.
Yes.
Right? And with the care comes other pillars like what kind of food are they taking? Is it a balanced diet? Is it is going to, for example, for a neuro rehab, you will require high caloric diet.
Yes.
Right? For any other kind of recovery, you will require high protein kind of diet. How do we decide all those things? And who will prepare this custom made personalized care? So these, this kind of outside hospital space care and people like us are giving that personalized care that the seniors want. Because each one of them is unique.
Yes, and it's important, like you said, each one of them is unique. And like you said, things that people take for granted. Like if you were to tell a loved one that, you are probably not giving the best kind of diet, they may get offended. And then they have the society which is telling them, you should eat ABC, not eat C, D, E, F. So I think it becomes essential for professionals to step up. Then we see recovery becoming tenfold better and faster.
And because it is, and very important, because it is out of pocket expense. In India, we are not covering them under insurance.
Yes.
So it is a burden on the families for this extended period of illnesses also. So it is imperative that we see that end of the day, when they are spending money, it is a society which is spending money. How is it we are going to increase their health span with the minimum spend?
Right.
So very important that you do the right thing at the right time, so they are able to spend the right cost.
Ma'am, so do you have any stories of when you started off? What was the scenario like? Were parents easily, were senior patients easily coming into your facility? Did you see that any remarkable change that you have seen, a story which you would, kind of see that motivated you to kind of push further in this journey?
I think more than the seniors, it is the kids who started changing the way they think. Because parents, if you see, always don't want to trouble kids. When they are unwell and the kids have to juggle a lot of things, the parent feels that, let me not give my child trouble, I will go and stay there. Right? So of course in their mind they must be feeling that I'm going away from home kind of a thing. But for kids it is my duty to take care of my parent when they are sick. How can I send them to a care center like this? So that is the mind change that we are getting, because then the children started to think, and when we also counsel the new people when they are coming, we tell the children who have even thought about taking this help are inspirational actually, because they are changing the society, the way it runs. When they will take care of the parent, probably the recovery period will be 6 months. But when you send your parent over here, your recovery period will be 6 weeks, and you get a healthy parent back to enjoy them more. I
think that's primarily important, because we are so caught up with what someone else is going to tell about our decisions. We are unable to take the right decisions at the right time.
And we do tell this to the children when they come to us. They talk to us that please take care, we are feeling guilty, etc., etc. We have, so we tell them, don't worry about what the relatives will say, because the mama or the mausi or the chacha, they are not going to be coming to your help when you actually need it. They will only say. But when your parent is recovered and come back fully at home, they will see the change, that how it has happened. And it is very inspirational for the kids to think like this. So we are seeing a lot of kids taking up this thought process of, I am not an expert, let me hand them over to an expert. And they talk to us also, that how do we have conversation with our parents to tell them. Parents may not say no,
Yeah.
But for the kids to suggest, also they feel guilty.
Yeah.
So how do we have this conversation? How do I initiate this conversation with my parents? Also happens.
Yeah,
Yeah.
that's quite interesting because this is where we need to actually start off, right? From kind of addressing questions on what is happening at the child parent level, the connection between both the parent and the child. So even when we talk about health as itself, like I can give you an example from my own personal experience. My grandfather's been diagnosed with Parkinson's for the last 10 years. And for him to have this done at home, that means we have to have a physiotherapist, we have to have somebody come see him as a nurse practitioner because now he has issues with mobility and issues with swallowing and everything. It came to a point wherein all of these couldn't have been managed by one person at home.
Yeah.
So how do you see that you are now the leading team for, leading care provider for dementia in south of India and in the entire country? In fact, you have the largest facility where you take care of people who have been diagnosed with dementia. What is dementia and what is it actually?
Right. So dementia is basically a neurological condition, right? Which leads to people. It's a umbrella term, right? Where people are not able to take decisions, not able to process information. It is concerning for the person because it is not totally that they are unaware. They come in and out. They know that there's something wrong, but they're not able to express it, right? So, and that also causes a lot of stress on them. And definitely to take care of them, the people around them don't know what to do.
Yeah.
It is like taking care of a 2-year-old toddler where you have a parent have multiple things to do. You have to go to office, you have to manage your maid, so the multitasking is happening, and you are not able to give that attention to the kid to do the right mental stimulation for the kid to grow better.
Yeah.
Right. Similarly, in dementia also it is the same thing, because we are so fast paced, we don't know what should I do for my parent who is suffering from this to keep them engaged mentally and let them feel the purpose daily. What is the daily purpose? What am I living for, kind of a thing. And they understand when people get rude with them or say that how many times will I repeat the same thing to you, they understand that. They feel bad. So that is how there is social isolation also happens. So dementia is quite a, if I may use the term, terrible condition. Unfortunate for human race that we have it, but we have it. And it does not have treatment. The only way we can do is manage it. And management requires some expert management. It just can't be give them TV, give them food, and that's it. It has to be much more than that, And we have seen that the health span of the people with dementia also improves when the right kind of interventions are done. That is why very important to identify early signs of dementia, when to intervene, when to take, when do I go and go to a doctor? Do I go to a psychiatrist or a neurologist? First is a neurologist. It's not a psychiatric condition. So there are a lot of myths also attached with dementia that they have to talk about. Then, first of all, we have to diagnose dementia, stage dementia, because the staging will help us to decide the interventions that we'll be doing at different stages. Then, of course, it is a progressive condition. It can slow down the progression. It can slow the decline, but the decline is coming. And when the decline comes, it becomes impossible for a family to take care of them at home. Then where do they go? And we need to protect their dignity and their whatever the quality of life they have. It becomes our responsibility as the family, as a society. So where do we take them? So we take them to centers, residential centers like the one we have, where everything is taken care of about them. It is just not bed to sleep, one bath a day or 3 meals a day. There's a lot of activity that happens, and as part of activity, they do a lot of art, a lot of physical activities, and last year we initiated a World Alzheimer's Day happens on 21st of September every year. So last year we had the first art exhibition of the art made by the elders.
Wow, that's brilliant.
And it was a huge success. And so we are doing it again, the second edition in Chitrakala Parishad, and you are invited. I will send you the invite. Please
Thank
come.
you.
Where we are going to be exhibiting the art made by them.
Yeah.
It is the part of the therapy that they are doing.
Yeah.
But we had so much of art, we said, what do we do with it? Let's share it with people.
Yeah.
And whatever we make the money out of it, which is of course very nominal, it goes to them as a discount in their bill.
That's
So
brilliant.
so they are doing it for themselves. So it gives them a sense of purpose.
Yeah.
So sense of purpose is something that is required by every human being to get up the next morning and say, what am I living for? So dementia is, as you started off with the question, what is dementia? I can talk for 3 days, but to just in nutshell, it is something very unfortunate, neurological condition, but it is there, and that is not in our control who will get it or who will not get it. But what is in our control is how to manage it.
I think that's rightly said. I think what is in our control is how we manage it. This comes down to any scenario in senior care today, right? But because at the end of the day, we can't go back 40 years and reverse everything.
Correct.
But we can start today
Yeah.
and see how we can manage the next 10 years.
Yeah.
Like you rightly said, in hospitals, the reason I started thinking out of the box was also because we are very good at giving acute care.
Yeah.
But we are not good at addressing the more needs of people where care is required.
And they have a reason for it, because the number of doctors and the health centers like that are lesser.
Yeah.
So they have to really churn out very fast. They have to treat and send, because when they're treating one person, there is already 10 in line to be treated.
Right.
So they don't have time for the care element of it. That is why it is important for us as an industry also to see, okay, somebody is doing treatment, I will step in for care.
Yeah.
I will step in for quality of life. I will step in for, so these are the different kind of portfolios that are coming out in the whole healthcare scenario itself. And it is very interesting how we are evolving as an industry also.
Yeah. Ma'am, next, when it comes to, you just told me about what dementia is and how it actually changes. Can you tell me what are some of the signs and symptoms that you can pick up at home? Earliest signs and symptoms, and what is something that a care provider or spouse, children can see and say that we need help.
Yeah. So very common early signs that we can catch are they being forgetful, keeping things key, for example, they are keeping things which is not supposed to be. Keeping a key from a table to a chair or a different room is fine, but keeping a key in a fridge is not fine. Right? So things like that. So when you see this forgetfulness or asking certain things repetitively, getting angry for no reason sometimes, social withdrawal, right? Changes in the way that they are able to comprehend things. So these are the early signs that they should, and these are the easily recognizable. I'm not going into even deeper symptoms. I'm just going into superficial symptoms. It is always better to think worse, get it ruled out and come back, rather than ignore it as a part of normal aging, because dementia is not part of normal aging.
Yeah.
Usually it used to be thought that it is normal aging. It is not. So subtle changes like this in any kind of the behavior or the intelligence or the cognition part of it should be an alarm and should be immediately go to a place where you can rule out or diagnose or stage dementia.
I think, like you rightly said, dementia is not a part of aging, and I think people should underline it, put it in caps, and understand that it needs care and it needs diagnosis. And it's very, very important for us to seek help.
Yes.
Which we all shy away from.
Yes. In fact, I have many stories of these kinds. There is a elderly lady working in a very good position. Husband has dementia, right? And she has been juggling. Kids are abroad. She is feeling very guilty to let the husband go. But the kids are now recognizing that the mother is now getting into depression. It is affecting her. His dementia is affecting her. She is yet working, right? So we were talking to her and counseling her that it's okay, don't feel guilty. It's okay if you let him come to our center for a week, you take a break, take him back for 2 months, then send him back for a week. Take that break, rejuvenate, recoup yourself, and come back. So these solutions also, when people will hear, it was very welcome for her.
Yeah.
So she did that, and she felt very happy. She's telling, okay, next time I'm not even going to wait for my kids, or I'm not going to talk to them. I'm going to see straight away, bring him over here, keep him for a week, because she saw what is being done with uncle
Yes.
over there. She said that you all are doing much more than what I could do at home. At home, what will she do? She will sit with him and watch TV, cook for him. Here, there is food given, there is exercise happening, there is interaction happening, there is activities happening, there are different kind of people coming and talking to them. So they're all engaged and happy. So what is required for a person? It is how well they are taken care of, how well are we addressing their physical and emotional needs. Who is doing it does not matter. How it is being done matters the most for this kid,
I
right?
think it's very, very important. Like you said, those minute details of it's not who, but it's how it's being done.
Yeah.
It's so important because it's impossible for a single person to engage,
Yeah.
whether it is a child, whether it is an elderly person, whether it is your own spouse.
Yeah, absolutely.
Because we put our young children in preschools because we are unable to engage and match that energy. But I don't know, when it comes to an elderly, that conversation seems like a taboo.
Yeah.
So now, when we go from this disease, another major disease that affects elderly is Parkinson's. And most people recognize it, but they don't want to do anything about it. So, what is it that today, if I have an elderly person who's my family member having Parkinson's, how should one actually manage it?
Of course, early diagnosis is very, very important. And, for kids when they're growing up, they have different conditions. For example, ADHD or any kind of those kind of childhood diseases are there. The way we interact with them changes. What we do for them changes. Parkinson's is something similar. Diagnose early. Of course, food and physical activity is the most important part of the whole well-being part. So that has to be paid attention to, and they need to be encouraged, because in Parkinson's, unfortunately, what happens is their brain is working absolutely fine.
Yeah.
It is the physical inability that sets in, right? And that the psychological aspect also has to be absolutely part and parcel of the treatment of a person with Parkinson's, because they are knowing what is happening to them and they are not liking it.
Yeah.
So early diagnosis, medications, of course, and you're a doctor, you know that diagnosing the Parkinson's is very, very difficult, but we have to these. And one more thing which people miss doing is titrating the dosage.
Yeah.
Very important. Every 3 months, you have to go back and readjust the dosage of the medication. You can't treat it, you can manage it. So the best way of management is to stock encouraging things, to give them the right kind of medication in the right dose. And one more appeal that I have for all the neurologists is, please treat an older person with Parkinson's as important as a 45-year-old, because that's a life.
Yes.
You can't say that, okay, 4 doses of levodopa per day is going to help, or 5 doesn't matter, let me give whatever. No, that attention needs to be paid. Unfortunately,
it's very important.
Yeah, then that what is the right kind of dosage, and when do I call them back? Whether it is 30 days or 90 days, you decide.
Yeah.
And the people should be encouraged to come back.
Yeah.
That let me titrate, and this is going to, and do these are the activities, 4-5 activities that you can do, which will help you live better.
Yeah.
It is not about just reducing the symptom of Parkinson's, but it is about helping them and equipping them to live better.
Yeah.
How can I do this activity better? For example, do you have access to different equipment? For example, a spoon. You have those Parkinson's spoons which turn around, etc. Then when is the right time that you say that, okay, let's try DBS on you?
Yeah.
Just because you're 80 years old does not mean anything. Give the choice to the family and the person that, okay, you may have 10 years to live, and nowadays the lifespan is going to be more. Now, I'm talking about health and lifespan. So lifespan is going to be more, whatever we do. right? It is going to be more. So it only becomes more imperative for all of us to think that don't think about the age, think about the condition and the person, and give them the treatment accordingly.
Yeah.
And don't treat the age but the person. If you think that, okay, doing a DBS is going to give this person a 5 years of good life, and if the person is able to afford it, why not?
Yeah. I think,
for example, hearing loss, for that matter, right? If an 80-year-old has lost the hearing completely, why shouldn't you think about cochlear implant if the hearing aid is not working?
Yeah.
That elder gentleman or a lady may have 10 more years to live, and they're hearing for the next 10 years.
Yeah. It's so important what you said, ma'am, because like you said, it's important to treat the person and not the age. The minute we see the age, it's just like it turns off the doctor also. He will die anyways in some time. What is it that if we treat him or don't? But today we are realizing that every life matters.
Matters, yeah. Every life matters, and the quality of life is something that we need to keep our focus on rather than the number of the age. Very
So,
important.
like you said rightly about Parkinson's, the diagnosis, and another thing that I have is that usually when doctors give out a diagnosis, doctors are trusted, especially by the older generation. I think they should give out advice on how to improve their quality of life.
Correct.
Either suggesting them a small exercise,
Correct.
which is shown to improve Parkinson's majorly by, at least 50-60% you see an improvement.
Yeah.
But somehow they fail to suggest it, and when they get it from an external source, they are not ready to accept it.
Yeah. True.
Have you
You're
seen
right.
such cases?
Absolutely. Absolutely. And especially I think I can sense it that the doctor has not told, but you being a doctor, if a family member is suggesting also, even if you are qualified, they will not hear.
No ways.
Ghar ki murgi dal barabar. Right? That happens with me in my house also with my mother. So my mother stays with me, and she thinks I'm the worst doctor.
Yeah, so I feel like once you have that advice from a doctor and more doctors prescribing it, because what happens is once grandparents are older, they also have older people who are their friends.
Yes.
Then they will start suggesting, I did that massage.
Yeah,
I did this therapy. You also do it, which doesn't have a scientific impulse, because I was reading this study which says that for Parkinson's specifically, boxing is something that stimulates their nervous system and the dopamine release in their brain.
Yeah.
But here we don't see any doctor suggesting any kind of physical exercise for patients with Parkinson's.
With the maximum they will say is do physio. But physio, then elders think that every physio session I have to pay money. So what are the 5 things that any person should do on a daily basis to ensure quality of life? It is in your hands. So you feel control. That I am doing it for myself. But they are unable to think because they are not trained. So these little extension of the roles probably might, it'll help and go a long way.
Go a long way, because they will see their patients come back happily.
Yeah.
And what are the 5 things that you would say, somebody is diagnosed with Parkinson's, they can do to improve their quality of life?
Physical activity, very, very important. They should consciously keep doing it. I just got a cue from you which says therapies, right? So we have also seen that Ayurveda external massages help a lot, because it not only improves the blood circulation, it just gives a sense of relaxation and it acts on the brain. So they can do that. Medicine compliance, very, very important. Socialize. Ask for help.
I think so important. The last 2 points that you said, socialize and ask for help, because they're so always busy in their lives that they've forgotten to make friends. And there is a saying, I don't know why, it's only in Indian culture, that your friends are not going to help you, so don't spend time with them. So in this rut, people just give no importance to this relationship. And we see those implications. What are those implications that you're seeing?
See, definitely what happens is, for the brain, new neural pathways has to be made daily. That is what keeps us mentally active, healthy, brain health healthy. How will the neural pathways come unless we have stimulations to it? How will the stimulations come? If I am getting up in the morning, doing my 2 hours of puja and eating my same breakfast, sitting with my newspaper, then the lunchtime, I'll have my lunch, I will take a nap, and then maybe go out and buy a liter of milk, come back, watch TV, and go to bed.
Yeah.
That's a normal retired person will do. But then the same thing, the brain is not getting any kind of stimulation because you're just going from one minute to the other.
Yeah.
But imagine if you had to meet two friends or a couple of friends where you will have some kind of discussion, some kind of argument, some kind of laugh, some kind of. So there's so many different things that happen. So this brain stimulation is very, very important, and that causes by a different human to be there.
Yeah.
Right, different person, because a person A will talk differently and react differently from person B. So for you to change from A to B to C is also very important. Otherwise, the A will become a normal.
Yeah.
That will not allow you to evolve.
Yeah.
So it's very important that you have bunch of people to do different kind of activities for different brain stimulation.
Yeah.
And of course, you have these now brain stimulation games coming up. Again, these are all by yourself, and I'm seeing going forward the gaming for the elders is also going to increase.
Yeah. I think that's a new thing because, like you said, now elders are becoming more and more lonely.
Yeah.
Right? It could be because they don't want to step out of their house now. They're so old that making new friendships and connections becomes a challenge.
Yeah.
So how are you seeing that change now with senior living facilities?
Actually, it's not bad. So they do have in the beginning, they do have a sense of that reserve, but because they have to come down for various kinds of get-togethers, whether it is Ganpati or whether it is Christmas or for the meals, they interact with people. Most of them start interacting, most of them change, most of them. So we are seeing all these positive impacts, and that's why we are so bullish about where this industry will go, because it is beneficial for them as a whole. By whether they are in senior living or senior care, they are addressed as the whole being, not one aspect of the being.
Yes.
So it's a holistic, management that is happening, or a holistic care that is given to them. We are seeing the elders coming up and changing, and most of them, as I said, we were surprised that most of them are picking up hobbies at this age, whether it is painting or whether it is learning to dance or play a tabla or whatever, they're picking it up right now.
That's brilliant, because I think it's what we need for our society.
Yeah.
Now, moving forward, when we say, seniors means usually in our homes, they expect children to talk, which is not possible, because at the end of the day, children are tired from the whole day of work and they really just want rest.
Yeah.
But the elder is still craving for that attention.
Yeah.
So the only attention they have is someday when the relatives visit.
Yeah.
Or on a weekend.
Yeah.
Or then they start saying, we want to spend more time with the grandkids, but they are not giving us time. So I think this solves for a multitude of factors, because these are again the root causes of depression, anxiety, and even certain issues of Alzheimer's, if I were to say.
Yeah, of course, absolutely. But here what I would like to say is that this is something where we as a society or a family have to take that call. It is important for the younger generation also to understand that it is not about the age.
Yeah.
It is about doing a right thing for another human being. The human being, by sitting with the older grandparent for 15-20 minutes and playing a board game or telling them how the day was, it is just giving a lot of happiness to the other person. When you are giving happiness to somebody else, you are also releasing endorphins.
Yeah.
You are also releasing happy hormones, which kids of nowadays don't realize that this is one of the ways also to get endorphins for myself, not getting a toy or a PS5 or something like that.
Yeah.
They say that is one of the ways. This is also one of the way, very easily accessible to me. Let me do that.
Yeah.
And it is, of course, a part, it becomes I would say, the duty of the parent to explain it.
Yes.
There is one more aspect, I don't know whether you know about it, something called as oral history. Right? There is a department, I think I was searching for it because it is there outside in India. There is some body available somewhere in Ahmedabad where the history is passed on verbally to from one generation to the other generation. What happens when oral history is passed from the grandparents to the grandchildren? Lot of positives.
Yes.
There are stories being passed. There are inspirations being passed. There is interaction happening and good feel for both the parties
Yes.
into different generations. So that something has to become a little bit more. I think we as a human race have to become more innovative into keeping this oral communication alive between different generations, because end of the day, it is our duty to see that as many humans are as healthy as possible.
Yes. I think
Right?
that's a goal that we all should
You
work towards.
should, health for all.
Yeah.
And it is just not disease free. It is disease of every kind, physical and emotional. So I think every single person has a duty and the ability to do this treatment. If you see, notice I'm using treatment and care and
Yes.
management in different aspects,
Yes.
because it is important to understand the
Yeah.
difference and what everybody needs to do, and what purpose this each word is serving us also is very important.
Yeah.
Now this, so interaction with these older people, that is the reality.
Yeah.
But we need to change that. When we are talking about advertisements, etc., that the way the advertisements have to be made for the kids is to involve these two generations, so that
Yeah.
they are motivated to do something together. For
Yes.
example, if I have to sell a PS5, I will have a kid and a grandparent.
Yeah.
So they're doing it together.
Yeah.
And it will help both the generations.
Yes,
You
I
know?
think rightly said. I think it's so important to have a connect between both the generations, which we are almost losing at this point.
Yeah.
Because they are both two separate sections that don't want to interact.
And the kids also need to know that they will also go there sometime and they will feel the same thing later on. That empathy factor has to come
Yes.
in. Empathy is something I also feel, there is more of sympathy that I see rather than empathy.
Yeah.
So that also has to increase, and we have to teach our younger generation
Yeah.
to empathize.
And the next thing where I want to go, Dr. Reema, is what is it that we have to do in terms of senior care when you talk about it that involves treatment, management, and care? How are these three kind of interlinked in this entire journey and process?
Okay. So treatment is, what will I do to treat hypertension? I have to give some antihypertensive is the treatment. Okay. Or there is a diabetic ulcer. I have to treat the diabetic
Yes.
ulcer. I have to do surgery. That is treatment, right? After the treatment is done, the surgery is done, I have to care for it. How will I care for it? The number of times the dressing needs to be changed.
Yeah.
In this particular manner needs to be changed. This is the physical activity you will do. You will eat this and you will not eat that, right? How will I sleep?
Yeah.
Head leg elevation. This is a care aspect of it, right? And then the third thing you asked was management. So when I put the treatment and the care together, what are you doing? You're managing it, the
Yes.
whole situation, managing it to go from point A to point D.
Yeah.
I want to be in D, so I will do all these things to ensure that I take you to D.
Yes.
So that is the package of treatment and care becomes the management. And the two things are different.
Yeah.
The interventions are different.
But then it is all a single package that everybody needs to consider it because all three follow each other.
Right. So, unfortunately, the way the healthcare industry is right now, I'm sure it is evolving and it will change, is the treatment part is taken over by a set of people.
Yes.
Right. As we were talking about, 20% is acute care. So, I will do the surgery and I will send you home. But the care and the management part of it, the care will start at, outside the hospital space. And by following, so the people who are caring and the people who are treating have to talk to each other.
Yes, I think that's supremely
When
important.
they talk to each other together is when you're managing that whole person.
Yeah.
So sometimes, we feel there's disconnection, the silos between the performance, of the two people working very independently. Well, we see it in the acute care also, when we are not talking about medicine interactions, drug interactions. Nowadays, most of the people, again, 70% of the people are comorbids.
Yeah.
They will have hypertension, they will have heart condition, they will have diabetes, they will have
a
Parkinson's, they will have,
polypharmacy.
exactly. But are they considered about, is my medication or their medication causing any kind of harm?
Yeah.
Nobody is doing that. And unfortunately, the statistics in India is not available. But I did look at some statistics of the US, and it was very surprising that 70% of the deaths that happen in the US hospitals are because of medicines. Overdose, underdose, medical interactions,
Yeah.
drug interactions. So we need to talk to, as healthcare, I think it is not a silos
Yeah.
industry. It is a collaborative industry. We need to talk to each other and to
Yeah.
see how we are, treating a being.
Yeah.
Yeah.
I think that's very important, and drug interactions are something that we learn about in medicine, but unfortunately, like you said, we don't practice it.
Yeah. And fortunately, from the time we started Kites, we were sure that we are going to be having a clinical pharmacist on board. So we have clinical pharmacists who look at all the treatment. So basically, when the older people come to us, 50% of them come with their own doctor's prescriptions.
Yes.
We look at it. Our clinical pharmacists look at it and speak to the primary doctor if they see any interactions.
Yes.
In case we are the primary doctors, then of course all the treatment is gone through us and all interactions. Yeah. There's one more thing that Kites does: antibiotic use. Yeah. Antibiotics is not used in Kites unless it is supported by documentation. So earlier, when I was the medical director directly, the antibiotic form had to come to me to sign to start an antibiotic. It has to have all supportive, symptomatic, as well as lab support document that I will say yes, you can start it. Now of course the medical director does that. So that process happens. So we are trying to do our small bits into seeing that how we treat the whole issue of whatever side effects of the healthcare industry is there in our small way. Yeah. We are trying to manage it, and even more for elders it makes a difference because we live for elders. We walk, talk, breathe elders all the time, and if we don't do the right for them, it is not fair.
Yeah, 100%.
Right? Yeah.
I think that's rightly said because antibiotic usage, especially in pediatric children and in geriatrics, both is not to be used as in how somebody likes it and popped.
Yeah.
But we see the other way happening. And I'm so glad that you brought up that topic of how that's so important and how you kind of manage that at Kites. Now, moving forward, you've gone a long way. I love the journey of Kites because I have seen it grow literally because I stay in North Bangalore too, and your first center was there, and now you've gone on to acquire Columbia Pacific. How's that journey been?
Personally, I think, yeah, of course, it is, you see it in the numbers, etc., and you're growing, whether it is the number of centers or the number of people that, you're managing. For me personally, the one day to the other is good, but only the way I do the work on a daily basis has changed. Earlier, I used to be doing it. Now I am getting it done. I am seeing that everybody is working together. We have a goal, we have a vision, and earlier we were we were little less people. Now there are more number of people. That's the only change.
Yeah.
Otherwise, the involvement or the passion or and it has not changed. It is the same.
That's beautiful. That's really amazing because I think that's what we need when we're making change, when we're bringing about change. And change makers are required today to see the world progress. And how does it feel that now you're impacting more than 2,000 people's lives on a day-to-day basis?
A lot of responsibility. So even more focused on doing things right. And we are blessed with very good teams.
Right.
We have brilliant team members. We have around 1,200 people in the company right now, and all of them, I think, the senior management, etc., the leaders of the group, I think we are blessed to have the team that we have today, and that is why I think Raj and I are able to walk this journey well, and our motivation, our enthusiasm, our passion is every day refueled by our team members. So we are very lucky in that aspect.
I think that's brilliant because that's what is required, and it comes with so much excitement that it's going in the right direction, and it's going in a direction of making people's lives better day by day.
Yeah.
And you've also now come up with an app
Yeah.
specific for the senior citizens.
Yeah.
What does that platform look like, and why did you come up with it? What was the need like in the market?
A very good question, and I'm glad you asked this question because so it's called a Seniorshield, right? And we said that we wanted to impact senior life early on. We were doing kites, which is sickness management. He said, how can I reach out to elders, as many elders as possible, to keep them as healthy as possible for as long as possible?
Yeah.
Doing personal visits, brick and mortar is not scalable. Somebody who needs my help, who's sitting in Nagpur or Delhi or Calcutta or anywhere else in the world also, how do we add value to their lives?
Yeah.
We know Geria, I mean, we know senior care, I mean, we know what seniors are. So how do we add value to them? Is digital.
Yeah.
It has to be a platform. And and technology right now is not new to elders. Everybody is savvy.
Yeah.
But we took care to see that the kind of interface that we created was as simple as possible as you're using WhatsApp.
Yeah.
So all those things were taken care of, and people asked us the same question, that one more app? Why? How do you think it is going to survive, etc.? So there are two differences over here. This app is not created by a technology company. This app is created by a service provider, because we as service provider know what the elders need and what the elders should do, right, to add value to them. So that's one part of it, because it is coming from our thought process.
Yeah.
Second part is the backbone of this particular app is a service provider.
Yeah.
So I don't have to go out doing a tie-up every year or every 3 years that, oh, somebody, you should be able to help me with the backbone.
Yeah.
I'm the backbone. So that gave us the confidence. So the app that was created, we wanted to just not talk about health and illness.
Yeah.
We wanted to talk about engagement. We want to talk about various other activities. So we came up with a very beautiful, compact, I call it a super app for elders,
Yeah.
which talks about health,
Right.
where we do online consultations with the doctors. So who all we have for online consultations? We have medical doctors, our own doctors. We are not aggregators.
Yeah.
This is kites doctors. We have kites Ayurveda physicians. We have kites psychologists, clinical counselors,
Yes.
clinical psychologists. We have clinical pharmacists. We have physiotherapists. All kites. They can, wherever they are, they can consult.
Yes.
Because again, their medical requirement, whenever they need help, 80% is treatable at home. You just need some kind of guidance, and it can be done
Yes.
online. In case we feel that no, it can't be done online, we will recommend you to go to a hospital or a doctor, whoever is nearby, and you can do that. But at least immediate attention is paid. At least a door is shown to you that, okay, you go knock at that door.
Yeah.
That is also done. Then there is another issue of number of medical records that they carry. So this app, what we did, just click a picture, upload it. That's it. You don't have to do anything, and it gets chronologically arranged.
Right.
And then we have different categories, whether it is a discharge, whether it is an OPD prescription, lab reports, or radiological tests, etc. It can be categorized automatically. You just have to click.
Right.
The way we have created this app also, it is just clickable. You don't have to type.
That is brilliant.
There is an option to type if you, in case you want to, but otherwise it is, just click, click, click. So it gives a very beautiful, how we used to, what we were taught to take history, right? The detailed history. It happens here with clicks.
Yeah.
So we have the patient's history. We have the patient's current medication going on. And that is one, the medical aspect of it. It also measures sleep. We have also helped them with a wearable where automatically their vitals are getting checked. What are the vitals? 4 vitals: pulse, BP, temperature, SpO2.
Yeah.
That's it. I don't require a continuous ECG.
Yeah.
If you require continuous ECG, the patient should be in the ICU,
Yeah.
not outside. So whenever they wear it, whether they want to wear it continuously, whether they want to wear it occasionally, they can do that. Whenever they wear it, the data will go and flow into this thing, and we will know. We have a track of the records are there. Then there is engagement happening, volunteering opportunities, employment opportunities. I mean, there are so many people who we have actually given them these opportunities. That what can you go and do where? Is there a musical program happening around in the corner or in your city? So we put all those information over there.
Yeah.
Then these health tips. depending upon the weather and the season. It keeps going to them.
Yeah.
It nudges them to walk. It nudges them to drink water. It nudges them to do the, to take the right calls. So that is engagement. Then we also have e-commerce. E-commerce, the things are curated by, again, us. What are the things that the elders want on a daily basis? 6 categories are there. Health supplements, of course, the
Yeah.
kind of food and all we're getting, we know that they
Yeah.
are deficient. So let us give them the supplements, what supplements they
Yeah.
will have. Then sometimes they are bored, or maid does not come when they are by themselves. I'm not talking about these people who are with senior living or guides.
Yeah.
They can be anywhere in their own homes also.
Yeah.
Help has not come, but I don't want to cook anything. I don't want to Swiggy anything. What do I do? So we have ready to eat things also available over there.
Yeah.
And nutritious, it has been, all the nutrition content have been checked by us. Then there are devices. Devices also is not wheelchair and walkers. It is all these funky devices like a lazy eye. You lay flat on your bed and the TV is right in front. You don't have to prop your head up to watch TV or a neck pain, etc. You lie down straight. So the angle of the glasses is you will be able to see the TV without even propping up your neck. So these funky things are there.
Yeah.
So we have put it over there. Then elder-friendly travel. Wherever they want to travel, either it is pilgrimage or it is any other things, they can do that. Then these are the things. And then we also have a option of a buddy. Whenever, and they can only converse, they can't talk, because there are a lot of elder abuse things also happen.
Yeah.
So the conversation will be initiated only by the elder. When they initiate it, the buddy can reply. So whatever doubts or questions or anything that they have, they can talk. So then the loneliness is also addressed in case they want to converse with anybody.
That's beautiful.
So it's a whole package together. So we thought it will help, and it has taken off very well.
Yeah.
Yeah.
And I think it's a whole package. From the business point of view and the back end, I can only imagine how much thought process has gone into this and how much systemic processing has to go into it, because it's a whole lot of things and you have beautifully covered every single thing.
Yeah. Most of the things that the elders would like to have a good quality of life, we have tried to put it in.
Yeah, I think it's beautifully covered. And elders, I think, like you said, the number one is click options.
Yeah.
That's so important for them, because how many of them have the habit of typing and vision to type?
Yeah.
So, ma'am, the last question I want to ask you, Dr. Reema, is should people actually retire?
No, they should retread. How we retread the tires, right?
Yeah.
So that's a new concept. I started off with myself that I will not retire, I will retreat. There has to be something that humans need to do, because if we sit, we are gone.
Yeah.
So we should think of, it is not a good idea to make hobby your profession.
Yeah.
But at one point in time, your hobby can become your retirement plan.
Yeah.
So it should not. I mean, going forward, I don't think this is going to change. 100% it is going to change, because everybody wants that self-worth.
Yeah.
And every day when I'm living, I need to do something. So we should not, that retire word should kind of change and morph into retreat.
Yeah, rightly said, because more and more people now should actually take the time to be busy.
Yes.
The minute our minds become idle or our bodies become idle, it is almost like we are rotting away now.
Yeah, absolutely.
And what do you see as some tips if you want to give to anybody who want to age gracefully and have a beautiful life, even past your 50s, 60s? What should they be doing from their 30s, 40s onwards?
30s, 40s is the right time. Lifestyle. Have a very healthy lifestyle. Eat a balanced diet. Do your exercises, which is physical body. Do your yoga, pranayam, whatever, for your mental well-being. Very important to take care of both body and mind. Eat right. It doesn't mean that you can't go occasionally to a pub and have a drink or something. You can. Anything of excess is bad.
Yeah.
So try to see how you can balance everything in life and go forward. I think it is going to be brilliant. Just keep it simple.
Yeah.
Keeping it simple is very, very important.
Yeah.
Not to think very complicated and multiple things that we need to do. That, okay, I need to hydrate well. I need to, so there's now one more thing called sheep. Sleep well, hydrate well, take care of your emotions. Well, I have an article on the website somewhere and I forget. So it's very important,
Yeah.
to have good sleep, good food, drink water, exercise, mental well-being.
Yeah,
You're
I think
set.
that's encompassing most things. Like most people ask me, should we stop drinking completely? Should we stop smoking completely? I mean, if there is something that is giving you social pleasure, which is so important in today's age and time, you can do it, but be cautious
Limit, yeah,
and limit
exactly.
yourself so that you're not affecting yourself in the counterproductive way.
Correct.
Thank you so much, Dr. Reema. I think it has been a wonderful conversation. And it's not something that we can end in an hour because there are so many components to it and so much that we have spoken about today, but still some things will always remain unanswered. But thank you for your time, and I think it was such an engaging conversation to have with you today.
Thank you so much for considering me to be on your podcast. And definitely, the topic that you have picked up, and I'm very impressed with the age that you come from and the kind of knowledge and the know-how that you carry is very
Thank
impressive.
you so much.
Thank you for being here and
Thank you so
doing
much.
this. It was wonderful.